hello, and welcome again. Welcome to the panel discussion, Humanity of Healthcare. So before we get started, I just want to go through a few housekeeping items. For those of you if this is your first session that you're joining us, I want to remind you that all attendees are muted and encouraged to use the Q&A box to ask questions. You can always raise your hand or use the chat if you are in need of technical assistance. We offer dental, medical, nursing, public health, and CHES MCHES continuing education credits. To receive credit, you must complete a survey. The survey link will be posted in the chat at the end of the session. Dental, medical, and nursing credits are offered at the session level and require a survey submission for each session. Public health and CHES MCHES credits are offered only for the full day symposium and require one survey submission. So here we go. Our first speaker today is Sarah Alman, MSW, LCSW. Alman is a behavioral health services, is the Senior Vice President of Behavioral Health Services at Zufall Health, where she is committed to behavioral health integration and developing a trauma-informed approach at all levels of the health system. Before joining Zufall, Alman worked for Jersey Battered Women's Service in several programs, including shelter, transitional living, and community counseling services. She holds a bachelor's degree in psychology from Rutgers University and a Masters of Social Work from the College of New Jersey. She also holds a master's level certification in violence against women and children from Rutgers. I'm going to continue reading all the bios for each of the panel discussions so that they can just keep going. Okay. Our next speaker after you hear Sarah will be no stranger to you, Dr. Emmanuel Mercedes, PhD, is a psychologist and the founder of Your Wellness Space, a Latino-owned and operated mental health company, the director of organizational wellness at La Casa de Don Pedro, and supervisor and trainer for the integrated behavioral health services team at Zufall Health. He advocates for the importance of mental health in the various domains of our lives and provides an actionable insights based on his over 20 years of professional experience. Additionally, Dr. Mercedes is a servant leader in various organizations as President Emeritus of the Latino Mental Health Association of New Jersey, board member of the Boys to Leaders Foundation, and board member of the Joseph A. Unani Latino Institute at Seton Hall University. Mercedes earned both his bachelor's in psychology and doctorate in counseling from Seton Hall. Our final speaker is Dr. Marcqwon Daywalker, MD. Dr. Daywalker is an integrated family medicine physician and executive vice president of clinical services and chief medical officer at Avenue 360 Health and Wellness. Previously, he served as Chief Health Equity and Wellness Officer at Access Health Community Health Centers. Daywalker is a faculty member and health center coach for the National Network of Oral Health Access, NOAA, Integrated Diabetes and Oral Health Collaborative, as well as adjunct faculty for NOAA's Culturally Appropriate Care Learning Collaborative. He's also co-chair of the Justice, Equity, Diversity, and Inclusion Committee with the of Clinicians for the Underserved. In addition, Daywalker serves on other state and national committees to improve healthcare services and has been a speaker at state, national, and international conferences. He received his medical degree from Morehouse School of Medicine. At the conclusion of this program, participants will be able to identify and discuss practical strategies for integrating self-care and trauma-informed practices into everyday healthcare delivery for both staff and patients. Explore mentorship and community building initiatives that foster emotional intelligence, cultural competence, and support within healthcare teams. Analyze and disconnect between healthcare buzzwords and real life implementation, focusing on how organizations can align their actions with these principles to improve workforce morale and patient outcome. First, you'll hear from Sarah, then Dr. Daywalker, and then Dr. Mercedes, right before we start our panel discussion. You have the floor, Sarah.
Good afternoon, everyone, and thank you so much, Dr. Duncan. It has been an awesome afternoon of learning already, and I'm so excited to be here with you all. To get us started in this panel discussion, I want to share a little bit about what humanity in healthcare means to me and my reflection in the last few years, some of the lessons that I've learned. In order to do this, to explain where I'm coming from today, what's led me to and prepared me for the work that we do, especially in these last few years, I want to take you back just really quickly to my childhood for a moment. I knew from a very young age that I was going to be a helper when I grew up. When people would say, "What do you want to be?" Sometimes it was a nurse, sometimes it was a teacher, never a social worker, but that's where I wound up. But I didn't really know how. I just knew I had that drive really early on. I was really lucky. My mom was a nurse, my aunt was a special education teacher, and I got to go to work with them pretty regularly and get to see the beauty of being a helping professional. I also had the honor and, of course, the challenge of being a caregiver role to my dad, who had a lot of complex health issues since I was around 5 years old. And this passion, this drive to help, to serve, eventually led me to getting my bachelor's in psychology, to wonderful internship opportunities at that time, working at DCP&P in the Trenton school systems, then to social work school, my work at JBWS, the Domestic Violence Agency, and then to here at Zufall, where I've proudly worked for the last 14 years. Zufall was my first job out of grad school. I always say they took a chance on me, and I've been really lucky to be a part of a team that started as one, just me, in 2010 to a team now of over 20 staff. So I get to see that growth over so many years now here at the health center. And I'll fast forward now to 2018. This is when I was lucky to be a part of our initial more formal trauma-informed care journey that got started at that time with a learning collaborative with the National Council for Mental Wellbeing. Since 2018, our system as a whole has done a whole lot of work around trauma-informed care. We've made a lot of growth too, and I won't be able to do any of that justice right now, but I do want to highlight a couple of the things that we've been doing. Within our trauma-informed care journey thus far, we have regular meetings as a team, as a system, and we've done everything from reviewing our policies to make them more trauma-informed, looking at our waiting rooms, our exam rooms, trainings for staff around reducing stigma and bias, de-escalation, vicarious trauma, creating our own version of the trauma-informed principles for Zufall, and then incorporating them into meetings regularly, and incorporating trauma-informed learning from the start of employment. So we start talking about it in interviews, and we cover trauma-informed care during orientation and so much more. So all these things were happening, taking on my career journey here at the health center in 2018. And towards the end of that year, I was lucky enough to move into the role as Director of Behavioral Health Services. And as excited as I was for that opportunity, I also, to be honest, had some angst of that helper role for me. What would that look like? My identity for many years professionally had been seeing patients all day, and that was going to shift drastically. But I quickly realized that my experience as a clinician helped me then as a supervisor. I was able to have a different perspective for understanding the work of my team, the challenges of being a clinician, of working in community mental health, working in an FQHC. And my desire to help didn't fade, but it did have to shift. I had to focus a bit more on what Dr. Mercedes talked about earlier today of the idea of helping the helper. So what are we doing as a system and within my department to ensure that the healthcare workforce gets the support that they need so they could be fulfilled, hopefully enjoy their work at least most of the time, and be effective in their roles. So fast forward a bit more time and even shorter for me because I had a maternity leave in there and the pandemic hit. And as a system, we, like I'm sure all of you here in this conference, were faced with so many challenges. It forced us as leaders to challenge the way we understood the workforce, the way we understood our roles as supervisors, as leaders, and the dynamics in general of working in healthcare. So much had shifted so quickly. Our trauma-informed care efforts were continuing during that time, but we also realized we couldn't keep doing the same thing. We had to do things a little bit differently. We had to focus more on staff well-being. So as a system, we knew that staff that are here today in the symposium, and all of you not from Zufall system, I'm sure experiencing similar things, we're navigating this complex world that we didn't understand. We were trying to be effective at work while we were experiencing fear, loss, and then having to navigate that in our jobs as healthcare professionals and also in our personal lives. So as a system, some things that we were trying to do during that time A lot of transparency, sharing about the pandemic, what we knew, safety, exposure risk, PPE, those kinds of things. Trying our best to support our staff so they could keep doing the work that they were doing, the incredible work they were doing. We offered drop-in staff support sessions. We had a COVID bereavement support group that was open to both patients and our staff for people who had lost loved ones to COVID. And more specifically, within our behavioral health department, it left us terribly short-staffed, completely overwhelmed, and what felt like to me, and I think my team would say the same, functioning in survival mode. As a leader, as a helper, I had to think a lot about what could we do to create an environment that was more than just that survival mode that we felt like we had been in for so long. How could we create a team that people wanted to be a part of? Especially in the behavioral health world, when people were leaving the field altogether, and lots of people were switching to opportunities that were popping up everywhere for full-time remote work that we just couldn't offer in a healthcare setting. And I'm just going to share two key areas for us that I think have been really helpful. The first one is our workforce development initiatives. We really had to take a deep look at how do we get people to want to work in our field, especially in primary care behavioral health. That was always been a challenge, and even more so during the pandemic. And then once we get people here, what do we do to support them in the work that we're doing? So we focused on finding ways to build up competencies, because we know that when people feel competent in their roles, it of course connects to good patient care, but also to job satisfaction and to the ability to respond to and bounce back from stress, because we know stress is inevitable and it's going to pop up. So across our department, we really tried to identify ways to incorporate more opportunities for learning and training and building those competencies together. Part of this, at the end of 2020, we were looking at all of this, all the problems that we were seeing, the challenges with staffing, getting really great feedback from the team. And based on this, we developed our behavioral health workforce development program. And this has really been an enhanced onboarding and training program for new behavioral health providers that were coming to work with us, as well as master's level interns. We also created more middle management positions within our department. So this gave opportunity for growth, for more opportunity to grow within our system, within our department, and also for more direct support for our staff. With having more leaders in the team, there was more opportunity to connect and have supervision and support that was really needed. Specifically to our department, staff development also looked like advocating for work from home to become a part of our roles in our department, not just something that was a pandemic necessity. And that was a big switch to be able to start posting our roles as hybrid positions, and then identifying other ways to enhance flexibility in an industry that seems so inflexible sometimes. So the other one quickly is relationships. We talked all today about the power of connection, relationships, teamwork. We had to remember that we're people, that teams matter, that people matter. So in our department, we work hard to make sure that there's opportunities for staff to feel heard, to know that they have good ideas and that I want to hear their ideas, trying to truly have an open door and not just check a box and say I have an open door. So creating space for all conversations, including the hard ones, even the ones that maybe I don't really want to have, but I know we need to have. Giving voices to the challenges of the work we do instead of shying away from those things. Checking in. So if I'm asking about a difficult patient visit, it's not just did you meet the needs of the patient, but then asking how the clinician is doing, asking how the case manager is doing. What did this bring up for you? Are you okay? What do you need? Talking regularly about setting healthy boundaries, not carrying the weight of our patient work on us by ourselves. And then connection within our team. So we have team dinners, we do end of the year reflections, we have a team book club, and we celebrate wins together. We have a group chat and we post everything in there, from patient successes to passing a licensing exam, a dog birthday, a vacation to a new place, a new hike that someone completed. And when I reflect on all of this in the last few years, I think some of the biggest takeaways for me is that my helping role continues since I was a little child until now, and it's forever growing and changing. That being a supervisor is the coolest way of helping professional that I've ever found. I really enjoy it. I love what I do. I've learned that I have to be more flexible. I have to take more leaps. And Dr. Duncan knows we've talked about this. I got to ride those waves of uncertainty, step out of my comfort zone, trusting myself more, trusting others more. And then as a system, what are we doing continuously about change and growth? We know that things aren't going to be perfect. We know that pandemics happen and elections happen, unexpected changes shift what we do from one moment to the next. And because of all of this, it is our job as a team and as a system to grow together, to create an environment that allows for that, and to really work together to make that happen.
Oh, thank you so much for sharing your story, Sarah. Dr. Daywalker?
Yeah. Good afternoon, everyone. Happy to be back with you all. Earlier, I talked about my journey, specifically kind of within dentistry, up until this presentation, really. And I want to take a few steps back, much like Sarah did, and kind of talk about why I got involved with medicine or how I came to even thinking I wanted to become a doctor. So my origin story in medicine actually was kind of rooted in trauma, quite frankly, when I reflect on it. I actually lost my best friend in middle school, secondary to at the time we called it domestic violence. Now it's intimate partner violence. But I could just remember when that occurred, having this overwhelming like sense of wanting to not have this happen to someone else, having this thought of like, oh my God, I wish I could bring them back. And much like Sarah, honestly, if I wouldn't have become a physician, the other thing that was on my mind was social work. So that's probably why I feel so passionate about the type of work that we're describing right now. And that's kind of how I got started in medicine. That kind of fast forwarded to me wanting to do things around like social determinants of health, and the reason why I chose to go to Morehouse School of Medicine, with this mission really to create primary care providers to go and serve in like medically underserved areas. And that kind of fast forward and kind of brought me down to Galveston, Texas, because they had a really strong program around like integrated medicine where I could get exposure into like behavioral medicine, as well as integrative medicine through the Andrew Wee Center at University of Arizona. So that kind of really kind of gave me my roots in terms of my tool belt, in terms of trying to figure out ways to kind of holistically take care of patients. That essentially kind of matriculated into me working in the community health center space. In my first job, coming out as an attending, out in 2019, actually. It was only a couple of months before we had this thing happen called COVID-19, right? That Sarah just spoke about. And that really shifted a lot of different things. And actually during that time, maybe a month or so before that, I was actually voluntold, if you will, about this trauma informed care thing. My CMO at the time wasn't really interested in kind of doing it. My director of family medicine was like, "Hey, I have too much on my plate. Hey, new guy, would you like to kind of try this thing out?" And lo and behold, we had this huge traumatic event occur or happen. So I can kind of remember at that time, um, the chaos, the worry, the fear, my personal fear, right? I also at that time too was a newlywed, had a newborn. My son was maybe Rex was a couple of months old. My father, my stepfather, who was living with us at the time, had multiple like comorbidities. So I was really concerned about bringing the virus back home. You name it. It was just it was a lot. If you guys can kind of remember back to those times. But I felt really empowered, and I don't know, like something in my spirit told me that I needed to do more, not less. So I was fortunate enough to be a part of a couple of meetings where I heard my CEO speak very candidly about not wanting to like furlough or let people go. Like how do we keep our doors open first and foremost, because people need their jobs, and then also secondarily we need to take care of the community. And hearing that call to action from my CEO, I never had spoken to him a day since I had been there. I sent him an email. I was like, "Hey, we have this trauma informed care thing. I kind of understand that it's for patients, but what if we flip this a little bit? What if we take that lens and just focus on our staff for right now? Because I think that would be really powerful." So we set up a couple of one-on-one meetings. We discussed some things back and forth. I got buy-in from the PCA, the Primary Care Association that was leading it. They had strategically chosen to stop the program because they felt like it would be too much. But me and the trainer that I was working with, we kind of asked if we could kind of continue and kind of put the focus on our staff. So that's what we did. And from doing that, I felt like we had a really great impact, subjectively, just by kind of continuing to kind of have that space where everyone can kind of convene, discuss, what it looks like to be trauma informed and support each other. And that eventually led to me becoming our director of health and well-being. And from that, I started to get a little bit of a budget. I started to put a program together, and lo and behold, we put together some interventions that after doing some surveys pre and post, actually hosted by the Primary Care Association, of the 73 health centers in Texas that participated in the survey, our site during the height of the pandemic actually was the only one that showed statistical significance for improvements in burnout as well as like overall well-being. So you guys will have access. I won't spend a whole lot of time talking about exactly what we did for those results, but you guys will have access to that. I understand at the end of this presentation, it was publicized and written up within HRSA, one of the HRSA toolkits. So you guys will have access to that. Let's go to my next slide. So really what I want to do here is kind of think about not necessarily what it took to kind of get those kind of results, but more so what was underneath and gave us the opportunity to even get there. So parts of this, I just want to have a couple of slides that have us start to think about how do we start moving towards being truly trauma informed versus like, what are the what's? Because if you don't have genuine, true, fertile ground and buy-in, you'll never get to where you're looking to go. So some of the questions that you should kind of think about is first and foremost is how do you show up in the workplace? And just I'm gonna go through the bolding here. I don't want to spend too much time. I want to get to everybody's questions. But you want to move beyond your work title. You want to think beyond your resume. You want to embrace your whole self. You want to think about the components that are really strategic within emotional intelligence. Next slide. No. Can we get them back? All right. And after you've kind of figured that out, and you move to a space where you're embracing your entire self, not just one of the sides or facets of who we are as our professional selves, you want to think about now, how do I search for who my colleagues really are? And once you've kind of done this for yourself, you can start seeing your colleagues, and you can think about your connections that you have beyond work. And this would allow for some strengthening of empathy. And once you kind of see that, there's just, again, that reciprocity where you start to kind of build compassionate teammates. And then you'll start to, after you've kind of thought, and improved in such a way around emotional intelligence, you can start thinking about social intelligence as well as relationship management. Next slide. And then once you get to that space where you've reached a level of EI, SI, you start to think about, okay, how do I sustain this in a very dynamic workplace? And there's things out there, they've become very buzzy of words, but to truly like move beyond what those words are and still continue to be true to oneself, honoring the beliefs of others, embodying core values, and keeping agreements is essentially what all of these buzzwords are about. And we'll kind of break those down and get to those a little bit more. And once you've kind of incorporated this with that ideal of like each one kind of teach one, impact one, then you'll start to build naturally organizational resiliency. There's another intelligence that's not often talked about, but another intelligence is cultural intelligence. If there's questions around that, I'm happy to answer those. And I think once you do these three things, think about those first three questions and maybe getting a little more thoughts to these bullet points, we can really start to take back or reclaim the humanity within medicine, dentistry, healthcare as a whole, because that's really what our field is really about. Now, with the fee-for-service model and a lot of other things, the business of medicine has kind of taken over, but we can reclaim it back by doing these things through curiosity, empathy, and support. So I just wanted to share those before we got into the panel. Thank you.
Thank you so much, Dr. Daywalker. Dr. Mercedes.
Hi, everyone. Nice to see you all again. So I identify as a wounded healer, right? And I think that many of us can relate with that. Is we use our own pains and sufferings, our own experiences of difficulties in life, to inform and to guide our own, sort of like intent and goal to actually make the life of others better. And that has given me some levels of insight about kind of like what it feels like to be in places and spaces where you don't feel safe. And so what I want to talk briefly to you all now is about psychological safety, which is something that I mentioned earlier today. As you can imagine, any significant change that we might make in our personal lives or in our workspaces, in any significant project that we have, it requires some level of risk. But to do that, there must be information in the system that tells us that this is appropriate and it's okay to take these risks, and essentially that you will not be punished or you will not be humiliated in some level for taking a risk, posting your ideas, raising your hands, and even making mistakes, right? And that's the concept of psychological safety, is the recognition that when we feel safe in certain spaces to take this risk and potentially make mistakes and speak up about what we are seeing, our concerns, our ideas, our troubles, well, that allows us for us to actually grow as individuals, as organizations. And ultimately, what we are able to do with this is we're able to make ourselves move in the directions of the changes that we want and need for ourselves. And, I see this both in small systems, as small as a family, when they come and see me for services, and, thinking right away about, families who come and say, my kid is having difficulty, or he's reacting or acting in such a way, it's destructive, or whatever it may be. And then, we explore a little bit, and there isn't a lot of safety there. There's some sort of a punitive spirit in the family system, or, people are not allowed to express how they feel or their thoughts. And of course, that makes it difficult for people to then open up and actually be open to collaborating and working together towards changes. And the same thing is true in bigger organizations. Briefly, I'll share a story with you. When I was in probably 5 years into my career, I was working in a hospital in which I loved the community. I found that it was meaningful. I was one of 2 psychologists in the entire hospital system. So I knew that my work was important, but I was struggling to keeping up with my notes. I had more than 120 patients on my caseload, and I didn't know that wasn't normal at the time, but I actually felt like somehow it was my fault, but I didn't feel kind of safe to say something. I was worried that if I raised my hand or said that, essentially that I was struggling, that my notes were backed up, or that, I couldn't keep up with the treatment plans, that, they were going to think that I was not adequate or good enough for the job. And that's despite the fact of constantly receiving positive feedback about the work. It just didn't feel safe for me to say, I have concerns about the way that we operate, or I have concerns about the way that I'm kind of like managing my work here. I think I need help, or I'm simply want to try something different. This is not working for me. And for a long time, I felt that was sort of like my responsibility. But I've learned, as a result of that experience, I learned a few lessons, and I'll share those with you, and then we answer some questions. First lesson is obviously psychological safety is a collaborative effort. It is a collaboration between your organization and you as an individual. And in essence, it's sort of like this very spoken contract, right? You cannot just assume. There should be a message that is going back and forth that says it feels or it doesn't feel safe, so that we can try to improve that. Because once we have that communication in place, then we're going to be able to make the necessary changes, right? The risks that it will take even to improve, or, let's say course correct on some of the things, some areas that we may be deficient on. Well, that requires for us to be trusting of each other in the way that psychological safety describes it. And if we don't have that, it becomes really, really challenging to make the necessary changes. And so, yes, there is going to be a component of it that is going to be on the employee end, and then another one that is on the organization. And the leaders, we hold ourselves responsible for creating the culture for that. And the second thing is, there is sort of ebbs and flows, and so we have to constantly be working on this. This is not a once we set it in motion and it gets done. No, it's really much like any other relationship. You have to continue to work on it, building and working, and building some more. And then there will be incidents and situations that will push us to some level of distrust or not feeling safe. And hopefully, we have built enough of a communication line that allows us to point out those circumstances so that we can go back to rebuilding trust, and ultimately be able to then, on top of that trust, build all the other pieces that would allow us to become the best versions of ourselves. So I'll leave it at that, and I'll be happy to answer some questions.
Thank you so much, Dr. Daywalker, Sarah, and Dr. Mercedes, for those really good stories and insights as to where your perspective is coming from. And something you said, Dr. Mercedes, wounded healer. Oh, that one sat on my chest because I would use that as the vocabulary to explain what my experience has been. I too was a part of the Great Resignation during COVID. I was burnt out, I was overwhelmed, I felt marginalized, I felt used, I felt abused, I felt stressed, and I felt like this wasn't for me. I felt like, who am I? Who am I kidding? Like this girl, this Black girl from Trinidad and Tobago coming into this people country to try to make a difference, and I felt like I had nothing to give. And it took me a year to re-enter the workforce. A year of therapy, a year of just people telling me you are necessary and me not believing them, until one day someone looked me in the eye and said, if not you, then who? And I think I got it then, because if I was feeling this way and I was giving and giving and giving and giving of everything I had, can you imagine someone who doesn't even care and they're out there harming people? So I got myself back in the game to make a difference. And that's where Zufall came into the picture. And I credit Zufall with really showing me that it wasn't that I was burnt out, it was that I was in the wrong place. And I needed to be in an organization that actually cared about people. So, with that said, I want to ask, I'm going to put you guys on the spot with some questions here. I'm going to start with Dr. Daywalker. You mentioned buzzwords. So I want to ask you about that. So we know self-care, emotional intelligence, trauma-informed care, and I know you said you were voluntold into that, right? So we're hearing that all over the place. So how can organizations ensure that these concepts are real talk, and not just throwing out the words or putting them in the
Right.
policies? What do you
Right.
think?
Yeah, absolutely. And it kind of goes back to the principles of what we do as an organization, is that you always do a general assessment, right? You got to get an idea of kind of where you stand, right? So you do the same thing within the core of the words of emotional intelligence. Like you take that word and you say, okay, what are the elements of this? Let's do an assessment. Let's see where we actually are, right? That gives you your pulse. And then from that, you really want to determine like where gaps may be or when that best next step may be. And that'll start to kind of give you an idea around your culture. And if you find out like you can't really put your finger on what you think your culture is, that also tells you what your culture is, right? Everybody has a rhyme and reason to like their culture and climate of an organization. Um, and transparency is going to really matter, right? So as you build something around like trauma informed care, or you build something around like Jedi, or you build something around cultural intelligence, whatever your piece of language that you want to use, you want to be transparent with your folks so that you can have a good like throughput process so they actually can see progress. So if you do an assessment and you don't share people with don't share with people in a decent amount of time in terms of turnaround, even though you had the best intentions in the world, that can lead to like that mistrust piece, right? So you've already kind of fumbled, if you will, we're trying to build on or add or change your culture. The other pieces of it too is actually kind of knowing where you are as leaders. If your executives don't or haven't done anything around Jedi and or trauma informed care, they shouldn't be the ones trying to say, hey, let me teach you guys about this. Like, no, there's experience, knowledge, and expertise within these lanes. So if you don't have that internally in your organization, bring those folks in, listen to them, follow that framework, and then you can actually get there. But it's really about kind of deconstructing the words, right? Yes, these words mean something. Emotional intelligence means something. Trauma informed care means something. Jedi, all that stuff means something. But if you really can deconstruct and kind of work on the principles, then you'll get to that space that you're trying to get to.
Dr. Mercedes, I'm going to let you take the next leg here just to follow up with what Dr. Daywalker was saying. How do you think organizations can hold themselves accountable for truly implementing these values? And what roles does leadership play in making them part of the culture? Dr. Daywalker just mentioned that, if they're not on board, well, if they are on board, what do they do?
I mean, it's as Dr. Daywalker said, it really boils down to culture. And culture is set in motion and established by leadership. And that is essentially the short answer to that. What you got to think about is when we are speaking about organizational change in a way that is positive and we recognize the needs that the organization has. The moment we are identifying these needs, it falls on the leadership to actually take action in order for those changes to actually happen. And it has to be established by the leadership because the vision is set in motion by those that are in power, right? And, although you may have individuals that are going to be on board, right? You may have middle management or you may have frontline staff who will be on board and who will support this. There will be sort of a glass ceiling that it gets hit if the leadership is not already taking into account what are some of the signals that we're sending to the entire organization about what is appropriate and not within our spaces. It could be something as simple as speaking openly about the challenges the organization has and our willingness to work on them. But then it has to move on into like making sure that every person who is of influence within the organization is actually on board with the same values and principles and is aligning whatever policies we have within the organization. They're aligned with these values and principles that we set forward for the organization.
That's good stuff. So, Sarah, um, you were talking about your experience during the pandemic and, the things that you have done. And you mentioned, a little bit, but you didn't say the word, but you mentioned mentorship. In what ways do you think what you did and mentorship in general can serve as a tool for improving not only the muscle memory to do this stuff, but to also the emotional well-being of healthcare staff?
Sure, thank you. So I think good mentorship has to do that. First of all, if we're trying to build good clinicians, good case managers, good patient reps, whatever role that is in our system, we have to be looking out for someone's well-being and not just, again, checking boxes that they know how to answer the phone the right way and fill out a form the right way and do a counseling intervention the right way, because that's not going to lead to good teams. It's not going to lead to retention. It's not going to lead to a good system. So I think we've talked so much today about relationships mattering, and workplace is no different. So when you have authentic, genuine, individualized relationships, right? Because a mentoring relationship is a one-on-one. It's not the same with 5 different people. You can have more job satisfaction. You can reduce feelings of isolation. And although we work in a big system, it can feel isolating still. It helps with staff engagement. It helps with retention. The staff, again, feel more equipped to navigate stressors. If you've got your people around you, your team, you've got a mentor who's rooting for you, you feel more equipped to take on whatever's coming at you, right? And then all of this, in turn, relates to good patient care because all the background stuff isn't in place for that to happen. And I think that part of that is that psychological safety that hopefully can allow for space for honest and open communication. So when that happens, staff can feel that they have the ability to be vulnerable, to be transparent, to talk about their struggles, talk about their challenges, and then get that non-judgmental feedback that allows for that safety, right? Because if they come to you with those vulnerabilities and you shut them down, they're not going to come back with them. And then we're dismissing that part of the emotional well-being, which is going to impact their technical skills, their ability to do their job. And the last piece, I think, for us as mentors, as leaders, we have opportunity constantly to model emotional intelligence, to model coping skills. So every day we are faced with difficult patient situations, a difficult interaction with a colleague, just the day-to-day stressors that exist in life and work. And when we do that modeling, we are helping our mentees to build those skills, to understand empathy and self-awareness, and again, those clinical skills along with that.
Thank you, Sarah. So that leads me to a question. We're modeling, we're mentoring. What if we're not okay as the leaders? What do we do? And we have responsibilities, expectations of us, right? We have deliverables and KPIs we have to meet. And we also have to have an open door policy and so I don't know, maybe Dr. Daywalker, you want to take this? How can we as healthcare leaders balance these responsibilities to mentor and the pressure of all the clinical expectations? And how do we make sure what we're doing is even impactful?
All right, I love this question because it's going to give us an opportunity to deconstruct. So let's take this emotional intelligence piece. And so when you think about emotional intelligence, it has like 4 quadrants associated with it. You have your like emotional awareness, like that's really you taking stock into, okay, what is my general disposition right now, right? We know that emotions can kind of wax and wane, but okay, how do I feel right now, right? And this is kind of thinking about like if you were to like forecast or look at your day, right? Let's say you have, we have some clinicians here, we have dental people here, we have administrators here. So if you were to take a look at your day and it has a schedule on it, right? You know that, oh, I'm in clinic or I'm in the OR this time. I have a meeting with my direct report at this time. I have a leadership meeting. I have all this stuff, and from your experience, whether or not these activities actually either drain you or pour into you, right? You know that maybe even the people that you're working with, right? That again, going back to that transference or counter transference, either you gonna give them some good energy or they're gonna give you some good energy, or on the other end of that spectrum, right? So going into that emotional intelligence piece. So if you already kind of know that you're a little bit low on it, it's really important for you to think about that EI. So let's deconstruct. You have that awareness, right? And then from that awareness, you think about management. So if I already know I'm a little tense just because something happened beforehand and I'm going into an even tenser situation, then hopefully you have some coping skills, right? That you can kind of lean on or leverage before you get into that environment, right? But also too, you want to kind of have an understanding of that social intelligence piece of it, where you have a history of knowing however interactions typically go. That way you can kind of think about how in depth should I go with this particular type of topic versus not, because you want to think about relationship management. Because at the end of the day, in most cases, anytime that we're doing something, as much as we talk about sustainability, whether it be people, policies, programs, whatever, we know that this isn't our last time working with someone. So you want to make sure that you have a healthy relationship. The other pieces of it too is that always remember, like when we're working in these spaces where we're organizations or we're businesses or companies, if we're not doing entrepreneurship for the most part, you always have supports. So whether you need like HR in a particular meeting or something like that because you're having one of those difficult talks, right? And you're like, you know what? I really don't have capacity to handle it the way I typically would handle it. So let me have my supports come in here, right? Sometimes you may need an advocate, depending on what kind of things are being discussed. Hey, I would tell you that even sometimes with my direct reports, I have a stress ball with me sometimes. I'm like, let me squeeze this stress ball a little bit because I want to make sure I'm able to kind of give the best support that I can. Also, too, you want to have a space for processing, especially for those of us that have the privilege of having some administrative time, right? Strategically doing some admin blocking for that, right? Because you want to set yourself up to kind of have the time where you go for your walk the time where you have that coffee, the time where you do whatever gets you into your Zen mode, whether it be meditate, whatever the case may be, because in these roles, whether we would like to suppress it or realize it or not, we are stressed, right? And it could be you stress, it could be good stress, right? We're doing really great stuff, but stress doesn't change depending on if it's good or bad in the body, right? So those chemicals don't know any different, right? So stress, whether you like how you're feeling, based off all the things happening around the agency or not, it has a toll on your body. The last piece of it that I will say, and that I didn't provide this handout though, there's something called reflective supervision. So reflective supervision is a way for us to provide supervision that is beneficial to both parties within delivering that. Because, as someone that's being supervised versus the person being the supervisor, there's an inherent like power differential. And like leveraging like motivational interviewing, allowing a person to kind of dictate how they would like to be supervised actually does something for both parties involved. So that's the last piece that I would add to kind of give a something tangible within this question, is that reflective supervision can go a long way in terms of like mentorship and other like direct reports or relationships that you have in that way.
Thank you, Dr. Daywalker. Dr. Mercedes, we kind of talked about a lot of these things about avoiding burnout. And in your presentation, you were talking about the sleep and eat and Dr. ABCs. And I don't know if everybody in this had an opportunity to hear about that and how you developed that. And I'm just curious if you can share about that again, because I feel like that is pertinent here. Because as a leader, when I'm thinking about burnout, I mean, I can't even think about being burnt out when I'm burnt out because I have things to do, and your Dr. ABCs was something that resonated. And I'd like to hear a little bit more about that. Thanks.
Sure, I'll be happy to share that briefly. So let's think about what the society tells us about our roles as leaders and what our experience ought to be as leaders. And oftentimes the focus is on our tasks and our responsibilities, and somehow our humanity is stripped away from that. And what ends up happening is that you have well-intended individuals who kind of focus on productivity and pushing forward numbers, which is super important, right? Like I own a business myself. I'm a leader in various organizations. I understand the need for there to be order and for there to be also push for efficiency. But what has happened is that sometimes we want to sort of like focus on these areas of productivity and think that the pit stops, the rest, the self-care spaces are not necessary. And we want to sort of like cut them out and just put a bunch of, productivity moments together. When the truth is, part of the equation has to be self-care. And so that is not a thing for employees that are not managers or leaders. This is for every single person. And if you want to see a deregulated child, show me a deregulated parent. You get that, right? And so what ends up happening is that simple things that we can do to take care of ourselves, we neglect them. And then when things get worse over time and we sort of crash and burn, we wonder what happened. But it started off with sort of something very simple, which is just adopting a culture of self-neglect in favor of whatever our product or whatever our service is. So I was trying to come up with something that would be simple enough for people to get, while also grimacing at the reality that every time I hear some of these things, I find them to be kind of like cliches and we're like, right? But they work because our brains need things to be put in certain order and rhyme and such, just to, for it to stick. So I started with the idea of Dr. ABC because I needed something to reflect daily routines. And that was the first part that I came out. So I actually wrote it out first. And then I put the initials together. So the daily routine being, it has to be something that you do daily, because I hear of people that say, well, I'm going to go to get a massage at the end of the month. But by then, you've already killed 2 or 3 people. You know, by then you ran somebody over. By then you curse somebody out at the front desk, right? It's too late. So you needed to have done something about that maybe 2, 3 weeks ago. And so it has to be something that we do on a daily basis. And then A is awareness, because that is really the basis of all what we're trying to do in terms of change. Without the awareness of what is happening in our experience in the moment, it is extremely difficult to make any significant change, if possible. B is body, because there is a connection between our bodies and our functioning in general. And if we're not healthy physically, and if we're not able to kind of have our ongoing motion, and we become stagnant, but more importantly, our health can decline. And not only that, but our physical health also has an influence on our emotional health, right? And then connections, because the driver for most of what we do is driving connections, or being in connection with other people, or having meaningful connections to the community around us. So, you know, I work as hard as I do because I care about providing my family a certain lifestyle. And, you know, if I can do that, give my family a lifestyle without having to work as hard, I probably do that, right? I don't work just for the sake of work. I enjoy the fact that I'm able to connect with my clients and my patients, and the organizations that I work with. Those are relationships. Those are really important. So connections are really important. But to nurture our personal connections, we have to make time for that. And that's where I suggest, you know, taking at least 15 minutes a day. It just doesn't take that long. Like I told you, I gossip with my family for more than 15 every single morning while I am driving, dropping the kids off. I can do that. I'm pretty sure everybody else can.
Oh, wow. If we had more time, we'd keep going and going and going. I just wanted to share a couple of the comments that we've been seeing and open the floor for questions so that we can make sure that the audience gets a chance to be engaged. We have an amazing comment from Allison for you, Sarah. She remembers the early days of you in your new role, and she feels grateful to be a part of the journey. And she saw how you navigated the complex world, and you did it in an exceptional way, and she's very fortunate that you work here at Zufall. Wow. I mean, that is like, whoo, that gave me chills when I read that. I was like, I have to read this out loud, because that just shows you thought you were just trying to make it and making it up as you go along, but people were watching you. And that's one of the things that we as leaders sometimes don't realize, or sometimes when we realize it, we get overwhelmed with the fact that people are counting on us. But when you get feedback like this, it energizes you, right, Sarah? How do you feel about that?
Uh, it's gratifying. It is a good reminder, like you said, that there's a world around us watching us always, right? The good, the bad, and the ugly. And as I said to someone who presented earlier today, we are our own worst critics. So it is nice to get that affirmation of the hard work that we're doing. And it's an example of Zufall because we do this for each other.
Yeah, we're getting a lot of feedback about how much this talk is resonating with their personal experiences, and how they felt after COVID. And some of them were talking about how so many of their colleagues retired from burnout or just left, and just doing injectables full time now, right? Like, no, nobody's in the trenches anymore. So this was such a powerful message. So thank you, Dr. Mercedes. Thank you, Dr. Daywalker. Thank you, Sarah. The discussion doesn't end here. All of us are open and willing to continue this conversation offline with any of you at any time. Those of you who work at Zufall know that all of us have open door policies for real. And I know I shouldn't say this out loud, but the staff that work for me know that I'm a PTO advocate. So use your time. I believe in you coming to work well and healthy, right? That's important because our patients deserve the best. So we want you to be at your best. So I am going to go ahead and just say my thank yous to all of you who attended this session, and I hope you left with something that resonated with you, and you feel empowered and energized to continue the good work you're doing. And just remember that leadership is not just about a title. All of us in healthcare are leaders because we are leading the charge for change. So everything that we talked about is concerning you too. Thank you, everyone. And just remember to fill out the survey if you want to receive CE credits at the end of the session. And now we'll all be routed back to the lobby to join the final session. We'll be talking about, are you fit to lead? Thank you.